So much love and appreciation to those of you who have been with me for the 2 year period plus that I've been doing this. Thank you for showing your love and support to the channel. And to anybody else who is brand new to the platform and you would like to support the channel, also, you can do it by way of Patreon, Anchor, the clothing store, and also the shoe shop that is listed in the comment description below. And again, thank you to any and all of you guys who have been here to support this channel during the 2+ year period. I wouldn't be able to do what I do every single day without you. I'm going to say this because this is something that needs to be said, and this is a story that really needs to get done that I don't realistically see, being presented for YouTube and anybody else, out there that just might still be watching my channel and monitoring the videos that are. The reason why I'm doing this video is due to the fact that I have people in my family, and this is something that needs to get talked about. This is something that needs to be presented. This is not something that directly needs to be hidden and thrown to the wayside, because we can clear cut look at the AIDS epidemic and how it is that that transpired and then rolled over into the societal norms, as people would sit up there and say. So in a sense, this needs to be talked about because people have to understand that sooner or later the same thing that I stated on this platform is going to end up affecting everybody. So if the numbers that are given directly from WHO, which is the World Health Organization, are 100% correct, which I'm believing it to be so, then, like I said before, this needs to be presented and this needs to be talked about. And in no way, shape, or form is any of the facts or the evidence being given directly in this video a way to try to uh, demonize, attack, or go after anybody in the LGBT community. This is meant to bring awareness to the things that are transpiring. So this is an article written by CNBC, and it is stated as such: who recommends gay and bisexual men limit sexual partners to reduce the spread of monkeypox? These are the key points. Men who have sex with men are at the highest risk of infection right now from monkeypox, according to WHO. About 99% of cases are among men, and at least 95% of those patients are men who have sex with other men, according to WHO. WHO's chief stated that men who have sex with men should consider limiting their sexual partners to lower their risk of infection and reduce the spread. The WHO chief also called out the media, public health authorities, and government to fight stigma and discrimination, which he said will only fuel the outbreak. For men who have sex with men, this includes, for the moment, reducing your numbers of sexual partners, considering sex with new partners, and exchanging contact details with any new partners to follow up if needed. The chief also stated his call to social media platforms, tech companies, and news organizations to counter harmful information, which he warned will only fuel the outbreak. Quote, the stigma and discrimination can be as dangerous as any virus and can fuel the outbreak, as we have seen with the pandemic misinformation, and this information can spread rapidly online. More than 18,000 monkeypox cases have now been reported across 78 nations, according to WHO. About 10% of monkeypox patients have been hospitalized to manage pain for the disease. 5 deaths have been reported in Africa. The WHO declared a global health emergency in response to the outbreak over the weekend as cases have rapidly increased. The current outbreak is highly unusual because the virus is spreading widely in Europe and North America, where the virus isn't normally found. Historically, monkeypox spread at low levels in remote parts of West and Central Africa, where rodents and other animals carried the virus. Europe is currently the epicenter of the global outbreak, reporting more than 70% of monkeypox cases. About 25% of monkeypox cases have been reported in the Americas, with the United States the center of the outbreak in the Western Hemisphere. The United States has reported more than 3,500 cases of monkeypox across 46 states, Washington, D.C., and Puerto Rico, according to the Center for Disease Control and Prevention. The United States has the second highest number of monkeypox cases in the world after Spain. Monkeypox is primarily spreading through skin-to-skin contact during sex. WHO and the CDC scientists have stated And Lewis also said that the virus will have an opportunity to spread more widely if people do not take precautions by limiting the number of sex partners and anonymous sexual contacts. Quote, if there is no intervention in the circumstance where there's a lot of skin-to-skin contact on a regular basis, perhaps in the context of multiple partnerships or contact with anonymous partners, then that will be a circumstance without intervention where the virus can spread more easily. In the past, people infected with monkeypox passed the virus on to less than one other person on average, which is the reason why previous outbreaks did not spread as widely. But Lewis stated an individual with monkeypox might be able to pass the virus on to more people now because global immunity has waned and smallpox vaccinations has become much less common. Monkeypox is in the same family as smallpox, though it causes milder disease. Experts have not been able to conclude whether monkeypox represents a new type of sexually transmitted infections, though it is clearly transmittable during sex. An advisor to WHO has also stated this. WHO specializes in STIs. Also unclear whether condoms would help reduce the risk of infection because monkeypox spread through close physical contact similar to herpes. Quote, the critical piece is really focusing in on close, intimate personal contact, prolonged contact that happens during sex as the key mode of transmission. Scientists of Spain and Italy detected monkeypox DNA in semen samples from patients, though it's unclear whether the virus is actually spreading that way. Though monkeypox is primarily spreading during sex, anyone can catch the virus through close physical contact. This includes hugging and kissing within a family, for example, as well as shared towels or bedding that are contaminated. There have been cases of women and children catching the virus during the current outbreak, though transmission appears to be low in the broader community at the moment. Monkeypox can also spread through respiratory droplets when infected individuals have lesions in their mouths. Through this requires prolonged face-to-face interaction. They also stated that the outbreak can be contained if people limit their risk of exposure now. Quote, it's very important for anyone who has monkeypox to isolate so that they can prevent anyone else living in their household or anyone else they may be in contact with. Household transmission is how this was first discovered. The household transmission may in some circumstances begin to occur. Most people who catch monkeypox are recovering in 2 to 4 weeks according to the United States CDC, but the virus causes a rash that can be very painful. In the past, monkeypox began with symptoms similar to the flu and then progressed to a rash that can spread all over the body. But monkeypox symptoms in the current outbreak have been unusual. Some people are developing a rash first, while others have a rash without any flu-like symptoms at all. Many people are developing a localized rash on their genitalia or anus.
Here comes a new challenger!
Okay, so I wanted to post the whole conversation. I wasn't going to do it in parts like I normally do because I didn't want somebody to try to like, oh, look at what he said and try to, flag the video. So this was a comment underneath a whole different video that dealt with a young black woman who ended up catching HIV. And she went through a lot of things, and it was also meant to showcase how dangerous a lot of these activities are when people do not know their status. This is why directly in the video, instead of it saying news, I said get tested, right? So Ron Mem stated, it's interesting how when it pertains to the LGBTQIA community, it's expected for us to be socially conscious and be aware of our health status, whereas straight men continue to have unprotected sex with women and maybe only be concerned of the potential pregnancy. Get it together, straight men. Be more responsible. I was like, all right, no problem. Fair point. Let me return that. I said people in the LGBTQIA still don't practice safe sex. Look up the stats. Look up those stats on Atlanta. And don't forget about monkeypox because that is what's taking place at this moment in time. He responded. Also, monkeypox as well as HIV is a social disease. Clearly, there's been data proving that anyone can contact it other than just gay men, but of course, label it as a gay disease. That's not what I did. That's not what I did. He specifically stated that straight men don't go out here and practice protective sex. I was like, you know what? Fair point. No problem. Since you want to list points and you want to list facts, I'm going to sit up there and list facts as well. This is a gay male that is coming to me, a straight man, trying to tell me what it is that straight people do. So I, as a straight man, am going to return that exact same energy and tell him what it is that you got people in the LGBTQ community out here doing, right? So he ended up having a problem with that. So his response was, you made a point to put emphasis on monkeypox and HIV. And yes, like I said before, I'm aware that promiscuity is the thing that the community or is a thing in the community. And I know that there are people that deal with various forms of ailments, but there are resources available opposed to how it was 30 to 40 years ago. It seems as though promiscuity has always been a thing among straight community, but they aren't pressured enough to seek resources unless it evolves to Planned Parenthood. And this is when I told him this, because I come from a different era. That's 100% incorrect. During the 90s and the early 2000s, they had campaigns. They had the Wrap It Up campaign. They had the Know Your Status campaign. They had a lot of different campaigns that they were sitting up there running, especially on BET. And I think they might have also ran them on MTV and a couple of other places as well. So the stuff that he is saying is quite ridiculous. Like I said, I'm pretty sure his time frame, he's much older than I am. So this is why he is not up on the information that I am specifically stating at this moment in time, and why it is that he is specifically directly in his feelings. But like I told people before, if you want to run up here on this platform and you want to start saying things about me that are not false, and you want to start trying to demonize me as if I'm trying to quote unquote demonize a certain community, I got you, because I don't got nothing but time here. So let me put a pin into what it is specifically that I'm saying, and I'm going to allow a man that is from the LGBTQ community to state what it is.
Like, it's not even a deadly disease. It's harder to be transmitted than COVID. But like, it's not even a deadly disease. It's harder to be transmitted.
So you heard the type of thought process that just one person, and this is a male in the LGBTQIA community, has about monkeypox. And you heard how I already read off in the article that it says somebody from WHO stated that they are calling on social media platforms, tech companies, and news organizations to counter harmful information, which he warned will only fuel the outbreak. That is harmful information. He's trying to, in a sense, compare it to something else in order to say, like, oh, well, it's not, really that dangerous. So why should we really care? And that's how dangerous this is. This is why this is spreading. And this is clear cut why it is that you have who is the World Health Organization stated this, recommends gay and bisexual men limit sexual partners to reduce the spread of monkeypox. Let me repeat this again like a broken record. Men who have sex with men are at the highest risk of infection right now from monkeypox. About 99% of cases are among men, and at least 95% of those patients are men who have sex with other men. Pay attention. The chief yet again, Tedros, stated men who have sex with men should consider limiting their sexual partners to lower their risk of infection and reduce the spread. It is impossible to do that when you have such ignorance like this that is allowed to feel this way, because that's all that is. It's feelings, because he didn't want to be there. He felt like this was, some type of thing that was putting him out of his way. He feels as though, oh, well, I'm clean and I know it's that dangerous type of mentality that you see within people that don't want to specifically check certain things. And then when certain things happen, now they're caught up like a deer in headlights. Like I said before, I'm doing my part. They said they called on social media platforms. So for anybody out here that got a problem with my video, y'all might as well go talk to the WHO organization that put out this information. If you feel at any point in time anything that I'm saying is harmful to the LGBTQIA community, take it up with the WHO organization, because that's exactly where I got this information from. So if YouTube, if y'all got a problem with what it is that I'm stating, take it up with WHO, because that's exactly who I got this information from. Because if I'm wrong, then you're saying that the World Health Organization is wrong, and that's the same health organization that called on you to put out information, which I'm not seeing on this platform at all, in order to educate people in the LGBT QIA community about what it is that's going on. Because y'all was real cute when it was June. Y'all wanted to do everything about gay pride and have all of those videos up there, but where are all of these videos when it comes down to monkeypox? Where is that at? Why don't I see that all over my recommended? Why don't I see that all over the pages whenever I log into YouTube? I don't see it. Why is that? Offline, right? California declares a state of emergency over monkeypox, and then followed by Illinois. Next, you have everyone Atlanteans scramble for the monkeypox vaccine, because you have a lot of men who can't find it in their state, so they're now going over to other states and other counties, other areas, in order to get this vaccine, which is more than likely also going to help in the spread again of the exact same thing that is going on. Next, you have monkeypox. Illinois' governor declares state of emergency over virus. Another one to the left, New York City Mayor Eric Adams declares state of emergency over monkeypox. Next one, Georgia clinic faces low supply of monkeypox vaccines as cases pick up. Like I said before, if anybody got an issue with what it is that I am stating, pay attention to the information that is directly going out. Pay attention to what it is that the World Health Organization is specifically putting out. Get directly out of your feelings, how it is that you feel, how it is things may seem, whatever it is. The facts are the facts. They stated that this is heavily affecting, at this moment in time, one community more than anybody else directly out here. When I showed you the video of the Asian man there, who did you see up there in California? You saw nothing but men up there. And who more than likely were those men a part of? What community? The LGBTQIA community. And you heard what it is that that man stated. He was like, well, this whole thing, with monkeypox, it's not even really, that serious. It's not really taking anybody out. It doesn't even spread like, the pandemic did. And it's not even really as deadly. He didn't even really care, because he felt, in a sense, not even out of sorts. He felt like this was a waste of time. And this is the main reason why these things are spreading, because you have a lot of dudes out here that are doing a variety of things. Like I stated before, you have men who are in the LGBTQIA community who are having unprotected sex. Gay men are sitting up there doing with other gay men. And then on the whole other spectrum, which is how this can spread to the whole other the rest, is that you have bisexual men who are both having sex with both men and women, and they're spreading it that way as well. So like I said, people got to pay attention to exactly what's taking place and exactly what's going on. And it's probably not going to be too long before Atlanta, at a certain point in time or another, is going to start to state call out a state of emergency. Like I said, expect that to more than likely happen. Because the main thing that needs to be happening is that individuals need to be made aware. Don't sit up there and make it seem like, oh, well, it's not really happening here, or the cases are really low, so we're not going to, directly put out that news because it's going to cause chaos and fear. No, man, you need to sit up there and put that out here, because if you don't, you're doing a disservice to not only the LGBTQIA community, but you're doing a disservice to everybody else as well. Because like I said before, sooner or later, what is going to affect one is going to end up affecting everybody else. So what I see out here is, I don't see YouTube or other social media platforms doing their job. Sort of, kind of, the news is doing their job, but more so especially, I do not see these government entities doing the job that they should be doing, communicating better with these communities out here who are being overwhelmingly affected more than anybody else when it comes to monkeypox, making them aware, educating them, and making sure that they get the necessary things that they need in order to combat what is going on out here. So like I said before, if you're going to get mad at me, go get mad at the WHO organization, and also go get mad at the government. Don't get mad at me for stating the things that need to be stated.